it's been shown through multiple studies that being overweight or obesity causes a negative impact on people's health. It decreases quality of life, decreases mobility, but also it leads to things like heart disease, diabetes, sleep apnea, all of which have been shown to decrease one's life expectancy. Cardiovascular disease is the #1 killer in America of both men and women, and obesity certainly increases your risk of cardiovascular disease. There's no absolute magic number as to what a patient has to weigh to qualify for surgery or how many pounds overweight. We go by the BMI, which is just a ratio of one's height to their weight. So it varies from person to person depending on how tall you are. So most of the patients we see are going to be roughly 100 pounds overweight. Other considerations, we always think about the patient's overall clinical health, things like heart disease, lung disease, what previous operations they've had. So all that plays into factor as we're considering patients for surgery. Surgery is definitely not the first step. Back to basic principles, we really teach our patients about healthy lifestyle, healthy eating, diet, and exercise, and that still holds true for most people. Most people believe that losing weight is about 2/3 diet and about 1/3 exercise. So what most people need to do is they really need to concentrate on their diet, and they really need to get in the habit of being conscious about the things that they're eating and drinking. So just simple steps that everyone can take is we really need to eliminate liquid calories. Patients really need to get in the habit of reading labels and seeing what it is exactly in the food that you're eating. And I think most people would be surprised if you actually turn the carton around and look at what's on the back, at what is actually in these foods. A lot of foods that are so-called healthy or low fat. In general, when something says it's low fat, it means it's high in sugar. So these are things that people really need to consider. At our bariatric center, we teach a kind of a low carb, high protein style diet. So that's what most people believe works best. But you also need to get out and get some physical activity and exercise. Okay, and we recommend 3 to 4 times a week, at least 45 minutes to an hour. When your weight is significantly decreasing your quality of life, when you start having other medical issues like heart disease, sleep apnea, diabetes, hypertension, and these things are getting more and more difficult to control, and you're overweight, then at that particular time, I think it's reasonable for most patients to consider weight loss surgery. And what we got to keep in mind is, at this point in time, about 40% of Americans would meet the classification for obese. So that's over 100 million Americans that are obese in the United States today. And this is something you never hear about on the news. So, and it's been shown in multiple studies, this has held true for the last 10 to 15, 20 years. Of all the patients that would qualify to have weight loss surgery, only about 1 to 2% actually have surgery. So there is a huge number of people out there that would benefit from weight loss surgery that we're never seeing. For a long time, bariatric surgery or weight loss surgery has really had a negative stigma. When it first started out 30 or 40 years ago, it got classified as dangerous or high-risk surgery, and that's just not true today. We do all our surgeries minimally invasive or laparoscopic. Patients go home in 1 to 2 days. Patients do extremely well. The surgery itself is very safe. It's been proven through multiple studies in the last 3 to 4 years that having weight loss surgery is just as safe as having your gallbladder taken out. And if you actually look at the data, our 30-day readmission rate is actually less than having your gallbladder taken out. So we just want people to know that weight loss surgery is a good operation, it works, and it's safe. Normally what we do is when we have a patient that comes in for an initial consultation, obviously we do a good history and physical exam. We really want to know, what has the patient tried in the past, what has worked, what hasn't worked. And then we really kind of hone in on what comorbidities or what health issues that particular patient has. A lot of the patients we have are going to have 2, 3, 4, 5, 6 medical conditions that we need to really optimize before surgery. So that's really what we concentrate on in the preoperative period. We want to make sure the patient is optimized for surgery, that their hypertension or their high blood pressure is controlled, their diabetes is under control. If they have sleep apnea, we want to have that diagnosed and get it controlled. And then we take each patient kind of on a case-by-case basis. We're also required to have each patient undergo a psychological evaluation and a dietary evaluation. And we set all that up through our office. So there are multiple steps. It is a process. It can last anywhere from 3 to 6 months before you'll actually get your surgery. So we ask everyone to be patient with us, but we will get you through the process. Like I tell my patients all the time, it's going to be a lot to do, but we will help you. We'll set everything up for you. All you have to do is just show up where we tell you to show up. The most common thing that I hear after surgery, by far, is patients say, I wish I had done this 10 years ago.